Okay, all I see we have 10:30, so I'll call a neighbors Dunn County meeting to order. Let the roll show all the committee members are present with the exception of Sarah, I believe. And then Chair Bartlett is here along with other staff joining us. I'm sure everyone had a chance to read the minutes. Are there any questions, and is there a motion to accept the minutes from last meeting?
Just one question on the date on the minutes for our next meeting. We don't have a meeting coming up on the 15th, do we?
No.
Okay, yeah, that was just supposed to be the 13th, and I think is all.
Is there a motion to approve?
Okay.
Steve, I think I heard you. I can't see you, but is there a second?
I can second with the correction that we changed the September 15th meeting to September 13th in the minutes.
Absolutely. Are there any other discussions? Questions? Hearing none, all those in favor say aye with the change.
Aye.
Aye.
Carried. Okay, is there any public comment? Carmen or Krista?
No public comment.
Carmen, nothing? Okay. We'll get right into the administrator's report, Carmen.
Right, thank you. As always, we start with Quality Assurance Steering Committee updates. So we had that meeting last week. There was nothing of major significance in there. We did talk about ongoing safety committee things in relation to our survey from the West Building, as we did receive that one citation that we talked about last week, and a couple of kind of FYIs. But it was our quarterly safety committee report. So we did go over that again, and just kind of a couple of changes that we made in re-education of staff as well. We also talked at great length about COVID and any changes, updates, and any restrictions, as well as the vaccine mandates that we are all aware of, which I'll talk a little bit later in more detail when we get to that agenda item. But that was the main discussion at our Quality Assurance Steering Committee. Any questions about that committee meeting at all? Okay, I'll move on to employment activity report, and I'll have Chris start with that one.
Good morning. I sent out the employment report last week. Gonna jump down to the number of interviews scheduled. We had 16 scheduled, 13 held, and then out of those interviews, we offered 12 positions, which of 11 were accepted. I'm going to jump down to the resignation. We did have 8 resignations in the month of August. I'm sorry. We lost a part-time homemaker due to school commitments. A full-time RN went to Mayo. We had a full-time RN went to a family care MCO. A part-time RN just didn't have any more hours to give us. This was her second job. A part-time CNA left for a position outside of healthcare. LTE homemaker, her availability ended and she went back to school. Part-time CNA, no reason, she just kind of left. And then another part-time CNA for school commitments. So you can kind of go down to open positions. And those were adjusted, with the hires and people leaving. We go on to active leaves of absences. You'll note that we do have 21 active leaves of absences right now, which is on the higher end. The majority of them are all education related for the CNAs in school. We have one LPN on an intermittent educational LOA. We only lost a little bit of work comp hours for one homemaker, just a day. And the number of shifts missed in August, I didn't change the date on that one. It should be August and not July. 37 or roughly 320 hours missed, and that was due to call in due to an exposure or have to get tested because they're ill. It's a good thing. So just to recap, for August, 11 were hired and 8 people left. So
I can just add a couple of things there. Of the 11 that were hired, there was 6 of those that were PM homemakers. So we have had quite a few homemakers starting. We have 2 more starting this week. So that's a total of 6, including them for that PM position. Chris has adjusted our orientation schedule for those individuals, as we did market this to like an after school job. And was kind of the intention. So trying to get those college students or high school students orientated off schedule so that they can come in after school. Because that was some of the frustration or difficulty with orientation, was that they would have to miss school to do so, which we do have on occasion with CNAs that are in high school. But a lot of times those CNAs are through the high school internship program. So it's kind of expected that they're going to miss school. But now homemakers are adjusting the schedule for orientation. So Chris has been adjusting with that to have PM orientation instead of a regular 8 to 4:30 that we would do for our normal staff. And in addition to the COVID leaves, I will point out that this number is going up. August wasn't quite as bad as what we've seen in past months, but this is continuing to go up. And this month will definitely, like next month's report for September, will definitely be higher. We're seeing more and more people getting tested. We did have 3 positive staff members over the past couple of weeks, about a month and a half, I guess now it's been. But we will see that number go up. We're having more people out for illnesses in general. Fortunately, not many of them have been COVID, but we have had people out for illness that have to be tested for COVID, similar to last fall. So I do anticipate that number to be significantly high for September's report. And the other staffing related thing that we talk about most months is the Cna Training Program. So I think I talked about it last month, is that the individual that we had coming, that we kind of slotted into that being a potential role for her, that didn't end up coming to the neighbors, was kind of what we were waiting for curriculum basis. So instead of that, I have reached out to other skilled nursing facilities in our area that have CNA training programs currently, to kind of get some references from them on, so we don't reinvent the wheel on making our own. So I'm just working with, right now I've reached out to one of our local ones in Eau Claire that has a longstanding CNA program, and just working with the administrator from there to try to get the ball rolling on that as well. Any questions about the employment report?
I have a question. I noticed the last 3 months, the open RNs have gone from 6 to 9 to 11.
Mhm.
Do you see that increasing, and how long can we sustain that?
So that has been a difficulty to sustain currently. We've had quite a few open shifts. That is, if you can notice on the resignation reasons, I think we've had 3 go to Mayo over the last 3 months. That's been our biggest one, and those were all full-time employees. So we did have quite a few going to other facilities. That is kind of the consistent thing that we've talked about in relation to pay, as well as they do every 3rd weekend, and holidays are every 3rd as well, instead of every other. Just a couple of things that we can't compete with when it comes to the weekends and the pay and everything else that goes with that. So. I don't know if Paula had something
Can
to
I say
add.
something?
Sure, go ahead.
Okay, sure. I just wanted to mention, yeah, Carmen did a great job of explaining all of that. I have not been able to even get any agency applications this past month for nurses or CNAs. And just if, Carmen, I'm sure we'll talk about this later with like the COVID stuff, but if the mandate does go through so that everybody has to have the COVID vaccine, we will probably lose all of the agency staff because there's very little staff from agency that are vaccinated. I've talked to my recruiters that I talked to, and they have said that other facilities that have mandated the vaccine, in which we don't have any choice over the matter, those CNAs have left their positions because they just do not want to get the vaccine. I don't know where they're going to work, but they're not staying in healthcare. So it just makes me a little nervous too, because that could possibly be, well, we have 12 full-time CNAs right now, the 5 full-time LPNs, which will be decreasing just because their contracts are going to be done soon, and then the 1 full-time agency RN. So just so you know, it's always right there on the backside or whatever, that we're always looking at that too, that they could be possibly leaving at any time. So
What reason do you see that did they give you a reason why they don't want to be vaccinated? Especially
some of them just say that they're scared and they don't want to do it. And I've tried to explain to a lot of them that actually, you know, like what Biden had said, that's going to more of the government and, you know, different type of facilities, that MA Medicare facilities, any like small town business that has 100 staff or more, they're going to be vaccinated. I know that 3M has gone to that. I know that a couple of the construction companies around town have gone to mandating. So, and I just talked to a nurse this weekend and she goes, "You're going to let me know when it's mandated, right? I hate to leave, but I'm not going to get the vaccine." It's like, she goes, "And then I'm going to be financially whatever." And I'm thinking, well, I don't know what else to tell you other than to get the vaccine, because it's like everybody, it's going to be that way no matter where you go to work, you're going to have to get the vaccine. So maybe by then, you know, they'll kind of understand that. I appreciate Paul's updates that he sends out periodically, because that goes to all of our staff. So they are reviewing, you know, what he has said as well. So that's great.
We've heard the whole gamut of reasons of why people don't want the vaccine. So as far from the original ones that everyone heard of the infertility issues, to I just don't want to government conspiracy, kind of the whole gamut across the board. I think everybody has a different reason. And some people just simply say, I just don't want to. So we've kind of heard everything. Paula and I both probably send out at least one each, if not more, reminders, updates, and things to staff a week that just say, if you have any questions, let us know. We can try to ease your fears, answer questions about it. Obviously, there's a lot of us here that are vaccinated that can say what our experience with getting vaccinated was, that we're all still healthy and okay and everything else. But unfortunately, there's just about 30% of our staff that we just have not been able to change their minds at this point.
It's too bad.
I just have one more comment to make. I just got a message because they were talking about having the 3rd vaccine and who's eligible for that. So Dr. Brown, our medical director, had commented that he felt that all nursing home staff and residents would be eligible, just because of the situation that we're in and who's most likely to get COVID, things like that. I did just get a message from Walgreens, who was our clinical site the last time we got our COVID vaccination. So they're looking at getting that 3rd vaccine set up and ready to go. They said they possibly know by this Friday or possibly Monday of when we were going to get that. There have been a couple people that have gotten the 3rd vaccine. I've gotten the 3rd one already. I know Dr. Brown has, and a couple other people. So
Good.
Any other questions on the employment stuff?
Yes, Dave. We can't hear you though, Dave. There you go.
Okay, I didn't poke it quite as quick. We're looking at the comp and class study.
Mhm.
And maybe this is something for Mr. Miller more than any of the staff here. But it seems like it's getting pretty important that we do something to try to to try to keep employees or to get more. So I'm wondering if when we decide what the numbers are going to be, if we could get that instilled in our wage package before the new budget comes out.
Paula? Go ahead, Paul.
Oh, okay.
I'm
So
not certain.
I would have to agree with Chairman Bartlett, just because every time, it's like if somebody says they're looking for a job, well, all you have to do is look outside. There's job signs all over the place. But I've seen several ads as of recently saying that they've increased the wages, minimum wage is going up. They've all kinds of different things of where other companies are increasing the wages for their current staff because they're looking for people too. I had a CNA come to me last week, a longtime CNA that's been here for a while, and she's been here full time. Basically saying she was tired of working as two CNAs. She's only one person, but often there's not another CNA in the building, so she would have to be the second CNA as well, and still getting the pay of just one person. She was hoping that extra money, that one person would have been paid if they were there, if it could be given to the ones that are actually working extra. I mean, a lot of it I know has to do with extra pay, but people are looking. I mean, she said, if I have to continue to do this, I'm not going to stay in healthcare. And whether they just say that, if they're blowing smoke, or if they're, just saying it to make us nervous, I just want you guys to know that we're still struggling with that on a daily basis. And I would appreciate if we could look at the wage thing a little sooner than later.
Just so, the same CNA did come and talk to me as well, and I did speak with Heather about maybe looking at some incentive pay for when someone is working short, or if in any way. So Heather and I spoke about that last week, and she's going to help look into that as well, if that would need an ordinance change, or because we do have those incentive pays for picking up and mandation. So I don't know if they could just get one of those, or if there would have to be a completely new pay code created. So Heather was going to look into that as well for that situation, at least.
Mr. Chairman,
Yes, Paul.
so I wonder if I could ask Chairman Bartlett to clarify what your suggestion was. Were you suggesting that we look at the possibility of implementing any salary adjustments this year as opposed to beginning in 22?
Yes.
We can certainly look into it. The big question is going to be, how do we pay for it?
Well, I realize that, but it looks to me like if we don't do that, we're probably going to be being short of staff, which means we'll have to look at closing more wings or whatever, neighborhoods. And if we start doing that, that's going to compound the problem of people, the word getting out that, that we don't have enough staff, all sorts of problems. I'm just saying that, if there's something we can do before the first of the year, I mean, we still got 4 months to go. Maybe we could do something before the end of the 4 months. A comment on the extra pay when somebody does extra work. We've done that before for different positions. It's usually been a higher position probably than the CNAs or the nurses, but we have compensated people when they've done more work than what was normally
Right.
asked from them. So
We also have the equity pay provisions in our ordinance now, whether or not it's the appropriate provision. But some practical considerations, provided we found the funds to pay, to initiate an upgrade per the comp class study this year as opposed to beginning in January. And that's a big provided, but even if we did, I think in order for it to be meaningful, we would have to have a special meeting of this committee to recommend the budget adjustment in order for it to get in front of the county, the executive committee and the county board by October 13th. October 13th is the county board meeting. And that's the only opportunity we would have that would be meaningful, because the next one would be the final meeting, November 9th. And you're only talking 2 months at that point. But it would take a special meeting of this committee to be convened and to forward the budget adjustment request.
Well, we would need the information from
Exactly.
Heather to, to be able to do that. But when the information gets ready, I think it's something to consider.
I will make a note to follow up on it.
I agree with you, Dave, yes.
In terms of
Carmen?
payment, the one thing that I can say for this year that was not in our original budget is that Medicaid increase that was intended to go to staffing. That was the whole idea with when they said they were increasing Medicaid, was to go to direct care costs, which is primarily staffing. We will get a lump sum payment, hopefully in October is when they're anticipated, all the way backdated to July. So July 1. So those Medicaid rates that we're currently getting paid, we'll get the difference of what they should have gone up to on July 1st in a lump sum in October. So I'm not saying that would cover all of it, but it would be an increase that we haven't had accounted for yet.
And it might, there are other considerations here too, including the way that our pay progression works, which is it kicks in January. If you make the adjustment to actual salaries this year, then it'll give 2 steps and it would be beyond what we've even budgeted. So are there alternatives where perhaps we could do it in the form of a quote unquote bonus or something like that, that isn't an actual pay adjustment? These things I need to work through with Heather Murray, our Human Resources Director, and Keith Stray, our CFO, in order to come up with options. So I've made a note to that effect. And if we need to convene this committee as a special meeting in order to take action if such is needed from the county board, we'll try to get that answer sooner than later and get back to you.
Sounds good.
Is there any other questions or comments on employment? Okay, then I'll move on to the referral activity report. So again, this month, this looks a little bit different as we have had to be selective on referrals and acceptance of admissions due to staffing, just the continuation of our previous conversation. So we started the month with 106 residents. We had 60 referrals. We had 11 residents admit to the neighbors and 49 residents not admitted. So we have seen our referral number go up. As we've talked about consistently for a while, it's been lower than average, but it has gone up. I also think this is due to we aren't the only facility having to restrict admissions due to staffing. We've heard that from almost every facility that we talk to, the administrators or DONs or whoever at a different facility. So it's been a pretty common thing across the industry. So then we're seeing more referrals because hospitals are having the challenges placing residents in nursing homes. So that has been an increase. We have filled some beds when we can. We're trying to keep our staffing at the same level and then have our residents and our census at the same level so that we are most efficiently using the staff that we have here. So making sure we keep a fireside right now has enough residents that one CNA is staffed down there versus if we drop it below, then it's not necessarily utilizing that one CNA properly. And then we're keeping the outer buildings at the same census as well. So if we have someone discharge or pass away, we're filling those beds, but not filling past that point at this time, just due to staffing. So in general, we've had normally we don't accept everybody. So that is typically it's about 50%. So I would say just based on laws of averages, we had 60 people admitted. We typically would admit, or 60 people referred. We typically would have admitted about 30 of those in a normal month, and not we admitted 11. So not all 60 would have been turned away just because of staffing. Some would have been turned away for a number of other reasons that you see on our normal reports. At the end of the month, we had 108 residents in the facility. We had 0 residents transferred to another facility. We had 4 deaths, and we had 5 residents discharged home. Our referral sources are all coming from Mayo as well. For our top 3, we have again seen Rochester have a couple. Sorry, my automatically timed lights went off. We have seen a couple more coming from Rochester as well. I also anticipate the spike in referrals to go up from places further away. One, due to people not admitting due to census or staffing, but also due to the COVID increases. We're seeing that across the board of nursing homes having outbreaks again in our local areas. So people that would typically be referred to a different nursing home because it's their hometown, we might be getting more of that as well when people are not able to accept due to outbreaks. Do we have any questions on referrals? Okay. Next, we'll go to Scott's report for the environmental and facilities.
Good morning, everyone.
Morning, Scott.
I don't have much to report at all other than business as pretty much as usual with work orders and repairing, keeping everything running smooth. I've got the guys keeping busy with the repairs and then also keeping up with the grounds, trying to keep those looking nice. I've got one of my guys that has been working on the cleanup of the flower gardens that are overtaken with weeds, hopefully to get that better. But my goal is to really get on top of that next spring to keep those flower gardens looking a lot better than they have been in the past so that the residents have that to look at. So things going pretty much as planned, pretty smooth.
Scott, I have one question. It's
Yes.
I found it in the vouchers, but maybe you can answer this for me.
Sure.
There was $448 paid to a tires and battery company. What would you have any idea what that would be? And I can wait too, but you might know.
That would be batteries for the lifts.
Okay. All right. I was hoping you weren't putting tires on something, your car.
No.
Or something. I didn't know.
No. Generally the tires and batteries category is batteries for the lifts and tires for the golf carts.
All right. Thank you.
Which the guys did let me know that some of the golf carts are getting pretty thin on tires. So we're going to be ordering some golf cart tires here coming in.
Just a heads up, I talked to my local shop and I ordered some tires for a vehicle. And he says, if you need some, you better be ordered in the next week because in a month we aren't going to get them.
Okay. Good to know.
Just threw it out there. So
Good to know.
thank you.
Thanks.
All right. Any other questions for Scott or facilities? All right. So we'll move on to COVID-19 update. So we've touched on a few of the big ones already. I guess we'll go back to the vaccine mandate. As most of you, I assume, are aware, last Thursday, President Biden did have another press conference, and he spoke about the vaccine mandate being extended to more than just skilled nursing facilities. So even though that still is going to be a difficult thing for us, it is a positive thing. Instead of having it be just nursing homes and then having the way out being down the street at the hospital, it is a good thing for us to have it be all Medicare and Medicaid receiving providers. So it just evens the playing field a little bit. So it makes it a little less frightening, I guess, on the way of staff retention in terms of the vaccine. As Paula had previously mentioned, I do think that we still have some people that would just leave healthcare. So then the added OSHA requirement is where the other one will come from for the 100 or larger staffed entity. That would be also helpful to us because the other employers in our area that we would probably see people going to would be 3M, Walmart, Anderson Windows, those big factory jobs, as well as where if someone leaves healthcare, we've seen quite a few people transition from being a CNA to going to one of those factories, which would also have the mandate as well based on the president's report on Thursday. So it is at least a step in the right direction, but it still is something that we are keeping a close eye on. I do think we have some employees that haven't gotten vaccinated that are just kind of waiting for it to be mandated. We've had some people say, I'll get it when I have to get it. So I do think we'll have some that'll just say, well, now that I'm having to get it, I will. But there are still quite a few people who, for whatever reason, whether it be fear or not knowing about it, the uncertainty, things like that, are still saying they will not get it. So we are kind of trying to be proactive on that way. We are telling staff that if they have questions, they can talk to us. We're asking staff to, if they are going to get vaccinated once it's mandated, to go and do so now. We don't anticipate having the actual what's called a final rule from CMS to come out until October. That was another thing from the president's press conference was instead of it coming in September, they now anticipate it in October. So we won't know the actual logistics timeframe, if there are any exceptions, anything like that until a month from now. But we're urging people to just get vaccinated now because it is coming. And the other thing we're nervous about is that there will be kind of a mass amount of people looking to get vaccinated at the same time. And we want to make sure availability of vaccine and appointments is there too. So having more people get vaccinated up until then would be beneficial for not only us, but the healthcare system in general being overloaded with vaccine appointments when we're already struggling to have staff in all entities of healthcare available because of COVID ramping up again. As far as COVID here at the neighbors, I don't recall if by our last meeting we had all 3 neighborhoods that had a positive case or if it was just 2 at that point. But thus far, since COVID has kind of ramped back up, we've had 3 positive staff members, 1 in each of the 3 neighborhoods. We are outside of our 2-week window for all 3 of those with no additional positive cases. So we were considered in an outbreak in all 3 neighborhoods, but all 3 neighborhoods were cleared of that outbreak, which was great for both our staff and our residents over here, because it does put some restrictions back on residents to try to keep them healthy if there is an outbreak. So in terms of communal dining, visitation and activities are all altered for a brief period of time during an outbreak. So we're happy that those did not extend longer than just the 1 positive case in each. We are currently testing twice a week again because we are over 10% positivity rate. And KT shared in a meeting this morning that we are actually above 15% positivity rate here in the county. So that is extremely high. Anything above 10 is our kind of the top tier limit for what we have to do here in terms of testing. And if we certain different restrictions on visitation, if we were under 70% vaccinated for residents, which we are fortunately above in all 3 of our neighborhoods, so we don't have to do that. But there are some other restrictions that come with that 10%. But luckily we meet the threshold for vaccinations. So it doesn't affect our residents as much as it could. But we are testing twice a week with both PCR and rapid tests of all staff. And then we only test residents if there is an outbreak. So all the residents are tested if there's an outbreak in their neighborhood. So we did have resident testing for a couple of weeks while we were working those outbreaks, but currently residents are not needing to be tested at this time. We have heard from other nursing homes in our area that there has been outbreaks of both staff and residents in local nursing homes. So it has happened. As Paula said, we are looking at the third shot or the booster shot for our residents and hopefully staff, as nursing home residents throughout this entire pandemic have been the most at risk with the health situations that they have, as well as with living in such close quarters to each other. It's a very susceptible to spread and disease. So we're hopeful to have that happen, as we have seen quite significant breakthrough cases in older populations. Dr. Brown shared with us this morning some statistics about that about 70%, I believe it was 70% of outbreaks has happened in people over the age of 65, which would be the majority of our residents. So we are hoping to get that sooner rather than later so that we can protect the people that we serve here. That's the big things that are going on with COVID right now. It has obviously increased our staff time on working outbreaks again, doing the testing again, reporting to NHSN, which Paula does every week. The more stuff that we have with COVID going on does increase the workload of that as well. So that has been kind of going back to what we were doing last fall. And we are kind of on the same trajectory of last fall. So our first COVID case, if we remember back a year ago, was Labor Day weekend. So we're kind of right back at first couple of cases now. So it was about exactly a year, and we're just hopeful that we don't see what we did last October and November. Any questions about COVID at all?
Just a quick one, Carmen. I'm wondering if new residents are vaccinated, are they still exempt from a 14-day quarantine?
Yes. So if they're 2 weeks out of their last dose, whether it be the single dose of Johnson & Johnson or a double dose of Pfizer or Moderna, they are exempt from the 14-day quarantine when they arrive. That is something that we have kind of kept an eye on as far as with the booster shot. If they change what the definition of fully vaccinated is, we don't really know. So that is something that we're just waiting to hear any changes, but thus far they haven't changed that regulation. They also haven't changed quarantine or like exemption from work regulations on if you're a close contact, if you're fully vaccinated. That would be my next assumption. So prior to vaccines, if you were a close contact of someone that was COVID positive, you couldn't work for your quarantine period. But then once vaccines came around, they changed that to being, if you're fully vaccinated, you just monitor symptoms and you can work. Now that we're seeing so many breakthrough cases, that would be the first change I would think that they would show, is that if you're a close contact, even though you're vaccinated, you're still exempt from work. So that could also add to some of our staffing challenges for filling those COVID shifts, but they have not changed that rule yet. Any
Other questions for Carmen? Is that all you have for your report then, Carmen?
Yes, it is.
Thank you. Reviewing the vouchers, does anyone have any questions? Besides myself, I've got one other one. The state of Wisconsin was paid $7,800. Is that for the bed tax, Jane? And good morning, Jane.
Good morning. Good morning, committee. Yes, that is.
Okay, that's what I figured.
If it's provider assessment, is that the description
Right.
you're looking at?
Right, exactly, yeah.
Every month we have that. Yep. Whether or not the beds are filled, we pay that. I believe hospitals pay that as well.
That's the same amount every month then?
No.
Huh. I gotta pay closer attention, don't I?
Well, unless the beds are decommissioned, but that's our fee to the state for all their services for inspecting us,
Okay.
kind of, sort of. Yeah.
All right, thank you. Anybody else have any questions on the vouchers? Seeing none, we'll get into the financial reports.
Okay, the reports that I prepared, the campus census report. The census has been a little bit lower in August, and the trend continues that Medicaid is higher than private pay. But that should work to our advantage in the future if Medicaid rates go up, and if the supplemental payment is based on Medicaid days, then that will help us in years to come. Any questions on that? On the census and the payer splits? Okay, the pool staff review. In August, it seemed a little bit lower. We were not as much got paid out, and I would expect that to increase in September, the amounts that we paid out. And from their previous reports here, it looks like pool staff is harder to get. So any questions on the pool staff report? Okay. The aging report. You look to the August 2021 column, it has gone down again. That's good news. And what I like to see is that 181 days to 365 and the over 365, that is leveling off. That's nice to see. It's still going lower. In the over 365 days, it's down to $138,000. So some of those old things are getting reconciled. And some of them are still collectible. They're payment plans, and we get money on those a little bit here and there as well. So that's going well. Most of our aging is in the top bucket, the current and the 31 to 60 days. And we're just about at our goal of 78% there. Questions on the aging report? And the financials. I'm on the wrong page. Okay, not a lot of difference from the previous months. We do have the COVID payments in there of $155,000 for year to date, and those expenses are matched underneath in the expense categories. With census, the variance will be up and down dramatically. We're not going to be within 2% of our budget because of the variance in census. Let's see. I don't have anything really to say about this. The depreciation is included in these numbers. The year-to-date, I'm on the wrong sheet of paper. I am so sorry. It all looks good, like we're breaking even, and with the COVID dollars applied, it's looking good.
Does.
Any
Does
questions on the numbers?
Yeah, I have a question on the campus-wide one. Way down at the bottom, the estimated depreciation, the net income, and then the estimated COVID payments. And the year-to-date net income is 305?
Yes.
No, okay. Well, I just, so we're without the COVID payments, we have a net income of 153,000? There's no COVID payments in that $153,000.
I believe that's correct.
Net income and loss, that is included, but it matches it. It's like a break even because the COVID reimbursement matches those expenses. So it nets out to a zero. So if we take away the COVID reimbursement of 445, I'm on the right sheet now, the campus wide. Yeah, I had paper problems here. Then we would take out $445,000 of expenses. We had the employment, not bonus, retention money that was paid out. That was quite a bit. And that's embedded in all of the lines, like say purchasing, that's really a salary line. Life enhancement is salaries, so that COVID payment of $1,500 or $1,000 person for many people is embedded in there. And then the expenses, the PPE expenses are embedded in the, say, nursing services and housekeeping, laundry. So those are in there. So yeah, we are doing okay.
So, well, I'm still confused. In the revenue, we have estimated COVID reimbursement of 445,000.
Mhm.
And then down below, we have estimated COVID reimbursement of 152,000.
That's in addition, that's money that has not yet been applied to our revenues. More expenses that are tagged to be coded. I haven't put them in the revenues because I haven't moved the money yet. Chris gives me reports on those shifts that are empty due to COVID. We figure out the increment of the cost and then figure out the increase in cost on those not little things, but the more complicated calculations. And those have not been posted, but I've calculated costs through June. Like increased PPE, increased dietary food costs, increased staff replacement cost. That's what that equals. So that money we should be getting and putting up into that estimated COVID reimbursement. But it just I haven't moved it yet. And for me to keep track of all the moving parts here, that's where it's at. Until I actually move it and make the journal entry and finalize those numbers, double check them, then they'll move up to the top. Yep.
Okay, and are they all? Okay, thank you. Got it.
Does that make sense? It's kind of a roundabout way to say it, but I just haven't finalized. So it's still at the bottom is really a rough penciled in number.
And it's not in the expenses yet either.
That one is, it's
Okay,
expenses.
then I got it.
Yep. So we add it to the, yep. So I'm adding it to the revenue afterwards because I haven't finished my work on it.
Are there any other questions for Jane?
I have one more item, the provider relief funds. We had up until September 30th to do our first reporting on that. And the screens in their website work a little differently than I anticipated. And I was able to use, leave it to the government. I was able to use lost revenue for all of our claiming for the first batch of grants. And that will leave more money to claim, more expenses to claim later on for the other grants. And it looks like there is one more coming, perhaps, one more provider relief fund payment number 4 they're talking about. I haven't heard much about that, but stay tuned. There might be more money coming.
Good, good. Are there any other questions? Hearing none, is there a motion to approve the vouchers and the financial reports?
So moved.
Kelly moves. Is there a second? Steve seconds. There's no other questions. Will all those in favor of approving say aye?
Aye.
Aye.
Opposed, same sign. Motion carried. Well, I don't think anyone have anything else. We don't have anything else on our agenda, so I will at this time adjourn the meeting. Have a good day.
Okay. Yep. You
Yeah.